You may have received a letter or been contacted by your urology team explaining that your next appointment will be a remote consultation. So what is a remote consultation? This is just simply any appointment that takes place between yourself and your doctor over the phone or using a video. Whilst this doesn't necessarily need to be a video call, they tend to provide more visual information and can be reassuring if you're anxious. So why have we given you a remote appointment? Your urology team have discussed your case and feel that it's safe and in your best interest to have a remote consultation for your next appointment. Remote consultations may offer a number of benefits to you. They allow your doctor to virtually assess you without you actually having to come into hospital. This is particularly helpful if you have difficulty travelling or you have a medical condition that might put you at risk. Many patients find it more convenient and time efficient. There's no time wasted travelling to hospital, parking, or waiting in the clinic. Your doctor may have already decided that a face-to-face consultation is necessary, but they might use a remote consultation as the first point of call. So what to expect next? If it's not already happened, one of the admin team will contact you to arrange an appointment slot. This is usually over a 1 to 2 hour window. At the same time, they may also offer for a relative or a carer to join you during your next appointment. After confirming your appointment with the admin team, they will send you a letter, email or text. This will include the appointment slot, specifically the date and time. It may also have an internet link or a telephone number for you to dial for your appointment. They may also send you in a patient leaflet, providing you further guidance on how the remote consultation will work. And finally, some patients may receive a pre-appointment questionnaire. Ask them to kindly complete this before their appointment or to send it in prior. So what do you need to know before your remote consultation? It's useful to check your equipment is working. If you're going to have a video consultation, you need to have a computer, a tablet or a smartphone with a built-in camera. It is important to check the sound and video quality of this. Try to make sure that you're somewhere with a good internet connection, as this can allow the consultation to flow a lot better. We always need to have a backup plan just in case the technology fails. So try to make sure that you've got your phone on you, just in case your doctor needs to ring you as a last resort. Make sure you are somewhere private so you can't be disturbed and the appointment remains confidential. How will the remote consultation work? Before your appointment time, you will need to click on the connection or link or have your phone available. Then you need to wait until the allocated appointment slot. Once the appointment starts, your doctor will ask if you can hear them and or see them. The doctor will then introduce himself and anyone else present. They'll confirm your identification and ask you to also introduce anyone else that's with you. Your doctor will then explain how the consultation will work and the time that you have together. Make sure you're happy before continuing with the appointment. There are a few tips for during your consultation. If using video, you do not need to stare at the camera, but just simply look at the screen. If you get cut off or the technology fails, just simply wait for a phone call. Ask any questions as and when you need. Try to write down any instructions from your doctor and make sure to understand what the next steps are. When you both say goodbye, disconnect the call. So what should you expect after your consultation? You should make sure that any agreed actions are followed up. These include any investigations, any treatments, including prescriptions, and any further appointments are arranged. Your doctor may decide to arrange a face-to-face consultation if they feel that this is necessary. For example, if you need an examination. You should receive a letter about the consultation summarising the plans moving forward, and this will also be sent to your GP. And finally, you may be asked to give feedback on your experience. This is very helpful to make sure we continue to improve this service.